Hello all, welcome to Practolytics, your healthcare partner. This is Ellen Green from Coding Operations Practolytics. I'm here with the part 3 from the Debridement series, and this video will help you understanding the documentation requirements and the utilization guidelines of the debridement services. With no further delay, let's start the video. Coming to the wound documentation, it's very critical for the delivery of effective wound care, the facilitation of the care continuity, and the proper health data coding. Inaccurate wound documentation can impact the ability to determine the best wound treatment options and overall wound healing process. Unfortunately, almost half of all the medical record notes on wound lack key details on the assessment and intervention in some settings. Don't worry, we are here to help you out. Let's go through the documentation contents that are required for a debridement. The patient's medical record must contain documentation that fully supports the medical necessity for the service. This documentation include, but it is not limited to, relevant medical history, physical examination, and results of pertinent diagnostic tests or procedures. The medical record should include the following information: an operative note or procedure note for the debridement service. This note should describe the anatomical location treated, instruments used, anesthesia used if required, the type of the tissue removed from the wound, depth, the area of the wound, and the immediate post-procedure care and follow-up instructions. Identification of the wound's location, size, depth, stage, either by description or simply drawing or a picture. A description of the types of tissue involved, the severity of the tissue destruction, necrosis, infection, or evidence of reduced circulation. If infection has developed, the patient's response to this infection should be described. The patient's comorbid medical and mental condition, and all health factors that may influence the patient's ability to heal tissues, such as, and this is not limited to mental status, mobility, infection, tissue oxygenation, chronic pressure, arterial insufficiency, edema, the type of dressings, any chronic illnesses if the patient is having, like diabetes mellitus, chronic heart failure, immune deficiency disorders, anemia, and so on. Moving on to the documentation requirements for the services 97597 and 598, hydro, the whirlpool therapies. These should be very critically documented for at least 10 visits. The documentation requirements for both the services 97597 and 8 are very similar, except the frequent skilled observation and assessment of the wound healing care recommended daily or weekly to justify the skill service. Minimum progress report must document the continuing skilled assessment of the wound healing as it has progressed since the evaluation or last progress report. Moving on to the utilization guidelines. As always, you have to be in sync with your LCD guidelines. Here we are going to discuss the cumulative guidelines, but we recommend you to go ahead and review your respective state guidelines. When the patient has required more debridement services per wound than we are going to discuss now, the medical record must include documentation reflecting neuropathic, vascular, metabolic, or comorbid conditions. Debridement of diabetic foot ulcers are more frequently, like once every 7 days for a period longer than 3 months, may not be reasonable and necessary. Services exceeding this intensity and duration of the treatment will not be considered medically necessary. For patients with chronic wounds being treated in an outpatient setting, services beyond the 5th surgical debridement. CPT codes 11043, 46, 44 and 47 per patient per year per wound may require a medical review of records demonstrating the medical reasonableness and necessity. Providers are reminded that the CPT code used to report the debridement must represent the level of the debridement and not the depth of the ulcer. This is a very important point. And then moving ahead, initial debridement may be deep and through the skin. Subcutaneous tissue, muscle, fascia. The subsequent debridement is often more superficial, and it is best described by the CPT codes 97597 or 97598 rather than 11043 or 11044. Bony debridements are to be performed only in the place of service inpatient hospital or outpatient hospital or ambulatory surgical centers. I hope this video helped you in understanding the utilization guidelines and the documentation requirements. Thank you so much for your valuable time and interest on our series. We will be back soon.